Okay, I'm going to talk about how to better help a narrow infrasternal angle achieve a stacked position. Okay, so first off, a stacked position is just getting the rib cage to align over the pelvis or the thoracic diaphragm over the pelvic diaphragm. And what that's going to do, that's going to increase the uniformity of which the diaphragm behaves. Okay, so what that's going to do, that's going to help somebody change levels better without dumping their pelvis forward and pushing their hips back. It's going to help them produce force more effectively because the diaphragm is going to be able to capture the guts and the fluids and push them up and produce force in more of a non-compensatory manner. It's going to increase the respiratory variability of an individual. So a lot of good things when we can get this stacked position. But just really quick, with the narrow infrasternal angle, if we remember, is going to be more of our inhaled axial skeleton with an exhalation compensation at the ISA or the IPA because they're analogous structures. And we're also going to have an open inlet and more of a closed pelvic outlet. Okay, and if we remember, the narrow infrasternal angle is going to be biased towards external rotation and flexion-based measures. And because of that pelvic outlet position, we're going to get more of an ascension of the posterior diaphragm and a descension of the anterior diaphragm. Okay, so we can see that we have a diaphragm that's ascended posteriorly, and remember, we're going to have this exhaled compensation at the rib cage there. So this person, because they have limitations in internal rotation, a great place to put them in is quadruped. Okay, so quadruped is going to allow gravity to act on the guts and move it forward and help bend some of these straighter ribs. So if we look at the pelvis again, if we can bend some of these ribs down here, we can open up the IPA and the ISA and give them more of this pelvic outlet opening, which is our internal rotation kind of position. So quadruped is great if they have 90 degrees of hip flexion and shoulder flexion. So what we can do is we can put them in static quadruped, we can put them into bear crawling, we can do lazy bear crawling where the knees are on the ground. And what that's gonna do is just gonna help open up the anterior chest wall and also the lower posterior pelvis. Now, if they don't have 90 degrees of hip flexion, what we can do is we can put them into hook line where they're just on their back, their soles of their feet are on the ground or elevated slightly onto a plate. And what we're trying to do there is we're trying to get the hamstrings to reorient the pelvis and bring it back in space to be able to achieve that stacked position. Now, if we remember, the narrower is going to have more of this closed pelvic outlet, so they have more concentric activity and kind of like things like lower glute max. So what we'll do is we'll put a block between their knees, and what that's going to do is going to allow those hamstrings to reorient the pelvis back without someone just squeezing their glutes and essentially just shoving their pelvis forward in space. What we want is we want this nice kind of relative posterior tilt of the pelvis. We don't want it to just get shoved forward in space. Now, once this person can get 90 degrees of hip flexion, hopefully we can get something out of that with the hook line. We'll put them in quadruped and we'll have them do their crawling and all that kind of stuff. When it comes to standing, doing something like a squat, I like to use a ramp. What that's going to do, it's going to move their center of gravity backwards. An anterior load is going to move their center of gravity backwards. And we're going to have a better chance of reorienting the pelvis out of standing. What I also like to do is put a block between their knees as well, because they're also going to have, again, that propensity to want to just shove their pelvis forward in space. The block is also going to hold their knees kind of in this straightforward space and allow that outlet to open up as they descend down into the squat, kind of in that kind of 60 to 120 degree range of hip flexion. So these are just some good solutions in getting the narrow to be able to stack effectively when taking into consideration kind of their own idiosyncratic non-uniform behavior of their diaphragm. So I hope this helps, and let me know if you guys have any questions.